I would like to ask you permission to use this video for educational purpose and for internet publication.
Yeah, absolutely.
Now, this is a follow-up testimonial, and the reason we are having this testimonial is because we did a surgery, but after the surgery, you had additional pain in your. Where was that additional pain after the surgery? Can you just?
My lower back area, right side.
Yeah, that was sacroiliac joint. Now, let's go back. 6 months ago, we did a 2-level OLLIF minimal invasive procedure.
Mm-hmm.
Now, where was the pain in the back and the leg before the surgery?
The pain was all the way down to my right foot.
Yeah, and
excruciating pain.
1 to 10, how bad? Excruciating.
9 or 10.
9 or 10. How long did you have that pain?
For probably 3-4 years.
3-4 years. When did that sharp pain in the leg go away?
Right after surgery.
Right
same
after.
day.
Same day. Now, this is important because here we are looking at that you had what we call grade 2 spondylolisthesis. And look at that. This is imaging from 3 weeks ago that shows bone is growing 6 months later in both front, and bone is as well actually growing very nicely in the back of the bone. And as well, we didn't take the back of the bone off as most of my colleagues would do. We just put the spacer in, lift it up, and many of my colleagues say that's really not possible to make the leg pain go away just by putting a spacer. They think you have to cut the bone, and that makes it invasive surgery versus my surgery.
Right.
But you are one of 1,000 patients who could sit in that chair and telling me on camera that you woke up and the leg pain was gone.
Yep, that's true.
Okay.
That's true.
So, and the back pain. Let's talk about the back pain. The back pain you had before the surgery and the back pain that you had after the surgery, how were they any different?
Now it's not really pain, it's just sore.
It got better in the last few
Right.
weeks, but your pain that we had after the surgery in the back, it was in your sacroiliac joint, literally where the spine and the pelvis are joining. Do you mind to point to it one more time where that new pain was? Right there.
Right
Okay.
down here.
So now, and we decided not to really rush into anything and give it time.
Right.
Usually the knee-jerk reflex is to just do something about everything.
Right.
Yeah, but we decided to watch it, do conservative management and physical therapy. When did you feel that pain is getting better in the sacroiliac joint?
Well, about a week ago it started to get much better.
Much better, yeah. Now, sometimes, as they say, you just need a little more patience and, just a little
Right.
time. And that's why they call you patient. Now, still we can do injection for that and help it. We know that people who have spine problem, almost half of them have sacroiliac joint problem. Many times after the surgery, the sacroiliac joint problem get aggravated. I use the analogy that your body is paying attention only to where we did the surgical the procedure, and sort of neglect with the positioning and so on, stress on the other areas. But usually once the healing in the spine progresses, again, your body pay attention to other areas and the pain start getting better, and sometimes all you need is time. Now, do you remember what we talked about? If the pain come back or get worse, what's the next step?
A steroid injection.
Yeah, steroid injection itself can be therapeutic, but as well we put some numbing medication to prove that that's where the pain is coming from. But at this point, I ask you if the pain is, you should do injection only if the pain is 6 and above, and you told me, what did you tell me?
It's below that.
So then meaning that we are not even going to do that at that time.
Right.
Okay? Generally, we know that half of the people who have spine problem have sacroiliac joint problem, and half of the people who have sacroiliac joint problem have spine problem. This is like having a knee and hip problem. They are connected. These are not unrelated issues.
Right.
Overall, so far, happy with the improvement so far?
Yeah, very happy.
Excellent. Now, how is the walking going? How was walking before the surgery, and how is walking now?
I still don't walk very far, but before I couldn't walk even a block.
Mm-hmm.
The pain was so bad.
Okay.
But now I think I probably could get out there and try it. So.
Well, thank you very much. You asked another question. You said you're ready to go and do stuff, doing things and so on. Doing activities. What did I tell you? how to do activities, new activities.
Just be patient, try it one day and see how it reacts.
For a few days.
Right.
Because sometimes, when you are doing it, the pain doesn't come right away. But your body usually tells you by going up slowly, you can find your threshold and let your body guide you.
Correct.
Okay?
Yep, I understand.
Okay, well, thank you very much
Yeah, thank
for the
you.
interview. Yeah, I appreciate that.